What's up, sports rehab experts? Today we're going to be going over hip impingements, my top 7 exercises you can do to improve hip impingement symptoms. And be sure to stay to the end because we're going to show you 2 bonus things, 2 mistake exercises that I think you should remove from any type of hip impingement type rehab program or hip impingement prehab type program where you're trying to keep these symptoms at bay away from you, so you don't have to deal with this constant irritation in the front side of your hip. I see these 2 mistakes all the dang time, so stay to the end so you can listen to both of those mistakes as well. First and foremost, when we're talking about exercise, it's important to remove provocative factors when you are in pain. And yes, sometimes this does mean modifying or removing exercises if it's impeding your ability to progress or reduce the sensitivity of the overall hip or injured area. This holds true for any injury, not just hip impingement. We need to reduce the sensitivity of the painful area, and that may mean modifying exercises for a time being so that you can decrease the stress that is occurring in a particular region. Now, in the active population, the 2 biggest culprits of increasing hip irritation or hip impingement like symptoms is a bilateral squat and a bilateral barbell deadlift. Reason being is it requires a lot of hip flexion at the bottom of a squat and at the bottom of a hip hinge. If you don't have the greatest hip mobility to begin with, this potentially could become problematic, especially if your pelvis doesn't have the appropriate variability to descend in a squat, which would be a downward displacement of the pelvis. There's also going to be internal and external rotation components to the pelvis too. We've talked about that in previous videos, so be sure to go and watch those. Likewise, with the hip hinge, you're really shifting your butt back. Your torso is going to be approximating towards your thigh more, so you're really closing down that angle. An individual who struggles to stay upright in the squat and makes their squats look very hip hingy will also display this problem. And that's often one of the problems of why someone who squats very similar to how they deadlift often ends up with some type of hip pain. We can call it hip impingement, but realistically it's probably just a repetitive use or overload when you think you're varying up the position or the movements, but realistically the movements look very, very similar, placing an extra amount of stress at the hip and not necessarily distributing it through the entire kinetic chain. So one of the first modifications you can make for any type of squatting movement, especially if you notice your torso leaning forward significantly in a squat and not being able to keep an upright torso in your squat, is to elevate the heels. And I'm talking on a slant board, not necessarily just wearing heel lifts or lifters for you power lifters out there or you Olympic lifters out there. We need to put you on a slant board that really allows you to keep a vertical torso. This vertical torso is going to reduce the amount of hip flexion that occurs. I'll show a picture up here. It allows you keeping an upright torso, decreases the amount of stress at the hip, places more demand at the knees. So we're kind of shifting your spectrum of load to the knees and away from the hip so that, again, we don't keep picking at the scab. We allow the sensitivity to start reducing at the hip, and then maybe over time we can gradually get back into loading the hip. But it's always definitely something you're going to want to be considering as far as the volume, overall volume you're going into, as far as how much you squat, how much you deadlift, especially if your squats and your deadlifts look very, very similar. You may be more advantageous for you to choose a different variation of a squat to make it look more squatty so that you can have a true difference between your squat and your deadlifts. That way the same structures aren't loaded repetitively over and over again. So for a modification that I like to use for a squat, for those of you who love to keep squatting and need to keep squatting, is using a heels elevated or a slant board squat. So that's modification number 1. Another alternative to that is a single leg anterior tap down. In this exercise, you're able to keep a very vertical torso, still place a lot of demand on your quads, so you can still get those quad gains that I know a lot of you are worried about missing out on because you can't squat. So this is another nice alternative. It's another nice alternative to throw into the mixture too, so you don't have to squat all the time and still get some type of quad gains going. Also adds in a very single leg stability component to this too, where you'll really work your glute as well if you do them appropriately. You also work ankle mobility as an added benefit of this exercise too. So this exercise right here is one that I love to program for many individuals, and you should probably consider it if you're dealing with hip impingement. Now obviously, if you are feeling some symptoms with either one of those two, you reduce the amount of depth that you go in. So for the anterior step down, you would reduce the height of the step. For the heels elevated squat, you might have to reduce the depth that you drop down into the squat. If you do those and it's still painful, then it's probably something that you have to get rid of from your program for a period of time, and then you gradually work back into maybe a heels elevated squat, and then eventually more of your typical squats that you would do with your feet flat on the ground as the sensitivity of the hip reduces. Now from a hip hinge standpoint, I actually prefer to, again, if the hip is sensitive, I don't necessarily have a problem with any sort of deadlifts. I love doing deadlifts. I program them all the time for individuals, but if your hip is sensitive, sometimes we need to modify the exercise again to reduce the sensitivity. So a single leg deadlift is very useful from this standpoint, because you'll actually probably still go through about the same range of motion, but because you're only on one leg, there's some added variability to the pelvis in the frontal and transverse plane that will occur. That extra variability sometimes allows for reduced symptoms to occur. Not always. Again, sometimes you may have to actually just remove the hip hinge pattern out of your programming for a period of time, but it's a nice alternative. So those are 3 exercises that you can do as alternatives. So they're ways of modifying your current programming of things you may already be doing in the weight room. Oftentimes these are active individuals who come see me and are already doing a lot of these movements already, and we just need to find something a little bit different to allow those symptoms to reduce, to remove the provocative factors first and foremost. Secondary to that is, what exercises can we start doing to help the problem, help the root cause in the first place? So these exercises, I like to include something that involves the hamstrings and the glutes. What the purpose of that is, it's going to orient the pelvis into a little bit more of a posterior tilt. So yes, we want to build strong glutes, strong hamstrings, but we also want to have coordination into those hamstrings and glutes to control position of rib cage and pelvis. From the lower standpoint, we're going to have to use the glutes and hamstrings to control the position of the innominate in the sagittal plane. That's where the most variability is from the pelvis standpoint. So that's where the low-hanging fruit is, to try to change some orientation to reduce the stress at the actual hip itself. Again, go back and watch some of the previous videos where we go into the biomechanics of this. You'll understand a little bit more of why that is. Secondary to that, we need some type of ab exercise to retract the rib cage, and something where we can do both of that simultaneously all of a sudden becomes a very, very useful exercise. The obliques and transverse abdominis are the most important muscles that we want to utilize to be able to really retract and bring in the rib cage, so that we keep the rib cage and the pelvis in a stacked position. Because in many of these cases, you'll see individuals who have an extreme arched back, or an anteriorly migrated rib cage, or anterior tilt of the pelvis, or their whole pelvis shifts forward and their center of mass shifts forward too, placing a lot of stress on the front side of their hip structures. So anything we can do to mitigate this and control their center of mass a little bit better are going to be very, very useful activities for us. So one of my favorites is the single leg glute bridge, where we emphasize a little bit more of a posterior pelvic tilt and kind of driving the knees forward. So both a posterior pelvic tilt and driving the knees forward, so we can get this kind of proximal glute hamstring tie-in area. You shouldn't just feel distal hamstrings. If you feel just the hamstrings down at your knee, you're driving the knees too far forward. If you're just feeling your glutes and maybe a stretch in the front of your hip or your quads, then you're probably driving your pelvis too high up into a standard a standard hip thrust or a glute bridge that many people think about. So what we want is more of this scooping action off the ground, where our tailbone kind of rolls up off the ground and our knees drive forward. And what you should notice is there's a simultaneously knees forward as the hips rise up. And if the knees are not going forward as the hips rise up, then you stop, and that kind of limits your height that you go at. That should allow the individual to feel their glutes and their hamstrings at that kind of proximal glute hamstring tie-in area, not just in the glutes, not just in the hamstrings, but both simultaneously. And we want to mitigate the amount of quad, hip flexor, and erector sensations that they may get with the exercise. So they should not feel it in those three areas: the quads, the hip flexor, and the erector spinae. They should feel it in that proximal glute hamstring tie-in area. Obviously, single leg is going to be easier than two legs, but we want to eventually be able to get to the two leg or the single leg version, because that's going to demand a little bit more of that oblique activity to be able to control the pelvis, again, which we know is very, very important for being able to manipulate someone's center of mass. Furthermore, before they even start this exercise, we want to make sure that rib cage can retract. Usually that's associated with an exhale and that reach up towards the ceiling. That's why you see me reaching up towards the ceiling with my hands. If the individual feels like they're very rounded when they do that, then after they reach and they retract the rib cage, they can let their arms kind of fall out to the side, and that'll kind of open up the chest. But opening up the chest is secondary to being able to retract the lower rib cage. All right, so there's one of the major exercises and a couple variations that I like to do based off of the glutes, hamstrings, obliques, transverse abdominis concept to reduce a lot of the repetitive stressors that many individuals get when they are noticing any hip impingement like symptoms. Now, another exercise that I like to utilize, this can also be used as a diagnostic tool for you too, is a leg lowering activity. So I'm going to show two variations of this. And the reason why I have two variations of this is one is very, very easy, and another is a little bit more challenging. What you'll notice with a lot of these individuals, in particular with those individuals who have their hips and their pelvis kind of shoved forward and their whole center of mass is forward, is that they'll feel a little bit of this snapping hip symptom. Many times this actually occurs in people without any type of hip impingement type symptoms, but for those individuals who have hip pain too, you'll notice this as well. I don't think it's necessarily something to be worried about, but it also kind of leads its hand into what could be causing some of the symptoms. And what it essentially means is that you're probably TFL, rectus femoris, and rectus abdominis dominant as far as your ability to control pelvis, femur, and rib cage. Now, all three of those muscles are useful in the right circumstances, but when they become over dominant, we become very, very front side dominant. Furthermore, the rectus abdominis and your TFL actually don't have that much surface area to be able to control position. So while they could be very, very powerful muscles, they don't do very much for you as far as controlling orientation of rib cage and pelvis. So we want to use muscles that have both, can be both powerful and control orientation of pelvis and rib cage. Those are going to be a little bit more better muscles to emphasize in your programs. So instead of emphasizing things that are rectus femoris, TFL, and rectus abdominis, we want to emphasize obliques, transverse abdominis, glutes, hamstrings, and psoas. So when you're doing these leg lowering activities, a lot of times what you'll notice is that people will complain of a snapping hip-like symptom, where it just feels like their hip is kind of rolling over a tendon, and it's creating this kind of like strum of a guitar string, and it's creating a popping sensation. Usually is not painful, but many times it's indicating that this individual is a very TFL, rectus femoris, and rectus abdominis dominant individual. So when you coach this exercise, you're going to have to do things to be able to help mitigate someone's tendency to want to overly utilize those muscle groups. Now, that's a little bit beyond the scope of this exercise, because there's a lot of different things and minute details that you have to pay attention to be able to control some of that. But one of the simplest solutions I can give you is just to not try to kill the exercise. You need to make the exercise seem a little bit calmer, more relaxed. Anytime you retract the rib cage, you don't want to overemphasize ab tension. It should be very, very subtle. Same thing with your tilting action of the pelvis. It shouldn't be this aggressive tilt. It should be a very subtle tilt. And that helps you engage some of the deeper musculature that you're trying to shoot for when you're working on some of these activities. Okay, so there you have all the exercises to consider. To sum up this video, I want to give you two things that you should not be doing. So we already mentioned how with many of these individuals, their center of mass is shifted forward. What this does is it places an exaggerated amount of eccentric stress to the front side hip musculature, primarily the quads, rectus, and some of the abdomen muscles. So if you're doing a lot of stretching of the front of the hip, while that can feel good for the momentary time being because it feels like your hip is tight and tense, the reason why your hip feels tight and tense is because you're holding it in a position that orients the muscles into an eccentric tension to begin with. So if the muscles are starting on tension, that's why they feel tight all the time. The solution isn't to try to tense them more by stretching them more. The solution is to get them out of a position that places them in stretch on a 24/7 basis when you're going about your day. So it's not actually stretching the front of the hip that gives you some momentary relief, but long term is probably actually creating some problems for you and not actually getting at the root cause of the issue. Secondary to that, you'll see a lot of individuals who love to do the pigeon stretch. Now the pigeon stretch, again, I don't have an issue with it in some circumstances, but in these cases, many of the individuals who have hip impingement have an excessive amount of external rotation at their hip and very limited internal rotation at their hip. Some of that could be due to, again, the orientation of the rib cage and the pelvis, but also some of this could be due to bony adaptations that have been occurring throughout the years. So we need to be careful not to aggressively stretch internal rotation. In fact, I would not say to stretch internal rotation either, but if you're stretching external rotation in the pigeon stretch, you're just kind of biasing someone further and further into the pattern that they've already started to develop. So that's not necessarily useful either, nor is trying to force them in the opposite direction. A better approach, again, is to remove the stressors, which we talked about first and foremost in this video in the first 3 exercises or so, and then emphasize positional control of their center of mass, as well as strengthening the muscles on the back side of the body, getting some of their deeper abdomen muscles involved with some of the exercises, and finally not only being able to strengthen those muscles, but use those muscles to control position as you strengthen them. Not just getting them strong and powerful, but getting them coordinated to be able to control position and being able to manipulate one's center of mass. So I hope you found this video helpful. I know there's a lot of things to be taking in there. If you'd like some guidance along the way when dealing with hip impingement so that you can avoid surgery for the longest period of time possible, if not altogether, and keep an active lifestyle that you enjoy to do, then get a hold of me at greg@sportsrehabexpert.com and we'll set up a diagnostic session to see how we can best help you out. If you're a rehab clinician who would like to learn more about successfully treating these type of patients in your clinic and add a new revenue stream to your clinic, then go to the Sports Rehab Expert Fast Track course to start learning some of the basics and the foundations you need to be able to understand, to be able to get these patients better, relate to these patients, and ultimately help these patients at a higher level. And then if you enjoy that course, you can take your knowledge to the next level in our Sports Rehab Expert certification with our Treatment Domination and our Assessment Mastery courses. Those 2 courses make up the Sports Rehab Expert certification. So if you're interested in that, if you're a clinician or a strength coach, email me again at greg@sportsrehabexpert.com and I'd be more than happy to give you a walkthrough of what these courses are. So everyone take care. We'll be back talking with you soon.